This is Lisa Lotritz, and my internship was at Renown Health. Renown is the largest private workforce in Northern Nevada with over 5,770 employees. My internship was specifically at Renown Health Medical Group, which provides comprehensive primary and specialty care. The health issue being addressed in this internship is chronic disease. Many chronic diseases can be prevented if there is a reduction in unhealthy behaviors and if efforts are placed on early detection. The most common unhealthy behaviors include a lack of physical activity, poor nutrition, tobacco use, and excessive alcohol use. My internship is focused on the senior population. Seniors over 65 years old comprise 12 to 13% of Washoe County population. However, they encompass more than 40% of the hospitalizations. The role of this internship in addressing the health issue of chronic disease is to improve the annual wellness visit process. The annual wellness visit was introduced by the Affordable Care Act and is free for Medicare and Senior Care Plus patients. It is a way to address health risk behaviors and allows time for providers to set up a preventive health plan with their patients. The goal of my internship is to utilize process improvement tools to identify waste and improve efficiencies for the annual wellness visit process. My first objective was to become familiar with the patient-centered medical home model and process improvement. I met this goal by attending meetings, workshops, and by shadowing Renown Medical Group and transformational healthcare staff. I attended several process flow charting workshops throughout the organization. At each workshop, the current state of the process was broken down into steps and by individual operators, and the barriers to the process were then identified. The team then worked to eliminate the barriers and improve the process. My second objective was to apply Renown's process improvement methods to determine improvement opportunities for the annual wellness visit. I collaborated with many key stakeholders in the annual wellness visit process to ensure that their input was included. I facilitated a process flow workshop for the annual wellness visit. I had providers, medical assistants, and leaders who are all involved in the process present at the workshop. They helped walk through each step and identify the barriers. There are different ways to complete an annual wellness visit. The process flow workshop focused on the pool production method of conducting this visit, which means the provider completes the annual wellness visit when the patient is in the office for another reason. To look further at the annual wellness visit process, I conducted key informant interviews with providers, medical assistants, and leaders. I also conducted a patient survey where I contacted patients that had completed an annual wellness visit between May and June of this year. I asked if they preferred to have a separate or combined annual wellness visit in the future. 41% of the patients preferred a separate annual wellness visit and valued the time they spent with the health coach. The majority of the Renown Medical Group providers are using the annual wellness visit outreach process. This is where the Senior Care Plus patients are scheduled for their annual wellness visit during their birthday month. They are seen by a health coach for 40 minutes, and then they are seen by their provider for 20 minutes. Currently, there are 8,254 Senior Care Plus patients, and only about 50% of them are receiving an annual wellness visit. Each Renown provider would need to complete 1.4 annual wellness visits every day in order for all patients to have an annual wellness visit. Another challenge is that many of the health coach schedules are often not full. My improvement plan includes a hybrid system, which allows the providers to not only use the outreach process to complete annual wellness visits, but to also utilize the pool production method if they identify a patient in need of an annual wellness visit. The improvement plan will outline the workflow for the health coach, medical assistant, as well as the provider using the pool production process. It will also indicate required training. Developing an improvement plan for the annual wellness visit process can impact the health of the community by improving healthcare access. Conducting the annual wellness visit when the patient is seeing the provider for another reason eliminates the need for a second visit and has the potential to increase access for other patients. Completing the annual wellness visit when the patient is already in the office can also increase the number of annual wellness visits being done. This also allows the provider to discuss health risk behaviors and order the necessary tests for early detection of disease. My internship at Renown provided a valuable experience, and I feel very fortunate to have had the opportunity.